This is patient FR, a 40-year-old female in room 412, bed 2. She was admitted on 10/7/2025. She came in complaining of shortness of breath and chest pain. She was diagnosed with a pulmonary embolism. She has a past medical history of multiple sclerosis, and she has had a breast reduction surgery and tummy tuck 15 days ago. No other past medical history. The doctors are pulmonary and internal medicine. She has no known allergies. She's a full code and on a general diet. Neuro-wise, she is A&O times 4. She is complaining of pain with ambulation and inspiration and also movement mainly of her left arm and shoulder. She has limited mobility and strength in her left arm just because of the chest pain that she's experiencing on her left chest. She does have pain medications. She was on Dilaudid, which was given at 7:30 this morning, but that has been discontinued. She is started on Toradol, which has not been given yet, and she was already on Norco. That was last given at 16:37, and it's PRN every 4 hours. She also has a muscle relaxer. I believe it's Flexeril, and that was given at 1700. Cardiac-wise, she was normal sinus rhythm on tele the whole shift, heart rate between 75 and 85. She had an echo that showed an EF of 63%, and there was no evidence of right ventricular strain related to the PE. She does again have the chest pain on inspiration, but it's typically on her left side and left shoulder and neck area. She was on heparin, but that was discontinued this morning, and she was started on Eliquis 2 times a day. I gave the first dose this morning at 9, and it's due again at 2100. Respiratory rise, she's on room air, and there's orders to keep her oxygen saturation above 92%. The CTA chest showed a proximal lingular vessel branch PE. For my assessment, she has really shallow inspiration, and again, it's just because of the chest pain. She was started on incentive spirometer, but even that causes really bad chest pain, so she can only do it about 1 or 2 times an hour. So we pre-medicate her so that she can do as much as she can, but we're working our way up from the little amount she can currently do. For GI and GU, her last bowel movement was 10/5 prior to admission. She does take Miralax at home and said she has a pretty irregular bowel movement schedule. She can ambulate to the restroom with a 1-person assist. Colace was given at 9, and it's due again at 2100, and she's also currently on her menstrual cycle. Her skin is intact. She does have surgical incisions at her breasts and umbilicus from her previous surgery, but they're all healed and there's no sign of infection. She does wear a compression bra, but she knows how to deal with that, and she's been told to not remove it by her surgeon. She has a right forearm 20 gauge that's saline locked. There's nothing running. The plan with her is pain management and also nausea and vomiting management. She didn't complain of any nausea or vomiting, but there's PRN orders for Zofran. And then she can be discharged home when she's having no more pain. That's it.